everyone. My name is Arunima. I'm a counseling psychologist at Dear Oliver Therapy. And today, as part of our conversations around men's mental health, we have Akash Mohan with us, who is a counseling psychologist. And he's here to talk about disparities and diversities when it comes to men's mental health. So first of all, thanks for being here, Akash. Thanks for doing this.
Okay.
Before we get into any of the questions, I guess the first thing I was hoping you could shed some light on is what does it mean when we talk about disparities and diversities?
Yeah. So I think the topic itself is very relevant in our current socio-political context because men are so diverse with respect to race, ethnicity, culture, migration status, age, economic status, ability status, sexual orientation, gender identity, or even religious affiliation, right? So each of these social identities contribute uniquely in an intersecting way to shape how men experience and perform masculinities, which in turn contribute to the relational, psychological, and behavioral health outcome based on some privileges, positive and negative way. So this is where it is getting very important that when we talk about men in general or men's mental health in general, we mostly ignore and erase men who do not conform to the normative assumptions of bodies, genders, and sexuality, right?
Right.
Yeah. So, and also men who do not follow the discourse of how men should be are mostly overlooked.
Yeah.
And we mostly focus our conversations about men and men's mental health towards the men who perform the normative roles of being masculine through a patriarchal lens, which is incomplete, incorrect, and mostly harmful.
Correct.
And I think that is a place where we really need to emphasize the fact that there exist huge diversities and differences in being a man. And when I say this, what I'm trying to communicate is like there are different kinds of men, like men who identify themselves as men, for example, a trans man, or men who is invisible in the eyes of heteronormative or cisnormative systems such as gay men or bisexual men, asexual men, or a feminine man, or men who is from oppressed caste or religion, or men with a disability, or men from other marginalized community. So we really need to understand that this perspective of inclusion was neglected, and this was causing more than enough harm to men who do not fit in. And we need to change the narrative, like the dominant discourse about it, and we need to create a new narrative of the diversities and inclusivity about men being diverse rather than seen through the traditional lens. I think that is the major significance of our topic today.
Correct. Yeah, I guess we can't talk about men's mental health without acknowledging that men can look and be and feel different than what perhaps the conditions to expect. Right.
Exactly. Yeah.
Okay. So the first question I sort of had for you was just if you wanted to tell us a little about your story in terms of what got you here to this job, this profession.
It's really a tough question to answer, I think. Suppose if I'm just recalling the old days, maybe during school days itself, I was part of several organizations in which I was or I have been really fascinated by how people think differently or feel differently or even act differently. And then I've been also somewhere with my friends or other people I know in the listening position, for some reason trying to provide a safe, confidential, non-judgmental space for them to say or do certain things. Putting it another way, like somewhere I had this very genuine desire to listen to and understand others from their perspective rather than putting my perspective into it. And also, as I'm recalling, like I have had some resentment towards the larger system that was forcing us to behave in a certain way, and it impacted hard on And this was a major glimmer for me as a child or during my school days to start exploring psychology per se. I'm still pondering over the question, hoping to get a better understanding. However, I can say, like, when I am reflecting myself in this seat of the therapist, like, I realize that being a therapist also means that you are a career for change, like being in the position you can facilitate desired change in our client lives, sort of giving an added meaning to that. I don't really believe these are the only reasons, but these are the some reasons that I can think of. Right?
Yeah. Okay. And as you were talking about these values of empathy and resistance and change that brought you here, it's also, it's pretty known that therapy or mental health in India at this point is still a very largely female dominated field. So what is that like for you? Do you think there are any differences, or what are your experiences like being a male therapist?
Again, the question is valid, like being a male in a female centric profession, I suppose. I think looking at my experience as a male therapist in the field with more female presence than male, at least in my experience, it hasn't caused any significant difference in my practice or career, I believe. But when I look back, like being a male gives me some additional privileges in the system that my female colleagues may not be having.
Okay.
When we are having conversations about workplace sexual harassment that sometimes women therapists may be experiencing from clients, like as a male therapist, maybe I'm not that vulnerable to that. And also in a system which is seen with a patriarchal notion, like sometimes being a male therapist is kind of giving an added advantage, some kind of a male authority, which is not even in the profession, maybe in the workplace that we are working.
Okay.
Or me being able to use my cisgender male privileges to engage in kind of self-care activities. So I think being a male in this field, associated with that male privilege, has given me some advantages. And this has been my experience since I started my journey as a therapist. However, I am also aware of the potential challenges the other therapists may be facing, or I may face in future, because of helping profession is generally very gendered. And there is this notion that women can care more, men don't listen, men don't understand, men don't have emotion. So these notions may sometimes enter into therapy and maybe refrain clients from going for a male therapist. However, I haven't faced such sort of an issue, but I have heard from my friends who are therapists or clients itself. Sometimes clients asking like, okay, Akash, you are a man. How are you going? Female clients asking like, okay, Akash, you're a man. So how are you going to understand my challenge or my perspective? So it is always a possibility of self-reflection as a male therapist, like how is this field and me are centered, and especially when it comes to most people who seek mental health services are women. So of course this gender dynamics, I think clinician needs to be aware of. Apart from that, I haven't faced any significant challenges, so to say.
Okay. Yeah, I think there's like this expectation that women are more nurturing and more warms. They'll understand more. And like we're talking about from a larger perspective, right? How gender might be showing up. And because you mentioned that sometimes you hear clients say that how will you understand what I'm going through? So are there any other ways in which you think gender comes into your therapeutic space?
Gender comes into therapeutic space with a lot of, I think, possibilities. One thing that I'm believing is gender is a very powerful variable in any outcome of mental health concern. And in fact, gender, I believe, is the most powerful variable when we are talking about mental health. And extending to a bit, like human sexuality plays a significant and huge role in impacting the trajectory of mental health, not only biologically but socially too. In my practice, I work with people of all gender, including cisgender person, transgender person, or gender non-binary clients.
Yeah.
Although clients, most clients comes with a mental health concern, we can see how the intersectionality impacting the onset, duration, help-seeking behavior, or even outcome of therapy. For example, a woman with a child may not be able to come for direct consultation because they are considered as the primary caretaker and only primary caretaker when man is working. Men not being able to approach therapists because there is this long working hour duration, etc. Gender diverse clients not being able to feel safe in therapeutic settings. So gender is everywhere in mental health, and the best thing that a therapist can do, in my understanding in practice, is to acknowledge the impact of gender and mental health on clients, impact of mental health on clients. And when I say this, it doesn't mean that our gender and our intersection identities as therapists are passive agents. It is so important as any modality that we engage in clients. And even in my experience, sometimes due to the current socio-political condition, therapists may find it difficult to see a man as more of a victim than the victimizer, or as abused than the abuser. Yeah. Or man facing interpersonal violence or domestic violence or relationship abuse. So all these biases can impact how we work with our clients. So it is very much necessary for clinicians or therapists to actively engage in the self-reflective process to understand how my biases about gender is also playing out in my therapy work.
Correct. Yeah. So it's not just our clients for bringing their gender into the room, it's also us and our own gender identities, what we are exposed to. Right. And you mentioned intersectionality and about how we cannot and should not ignore gender and its impact on mental health. And I just wanted to hear from you how you would conceptualize mental health and men's mental health specifically from a systemic perspective.
Okay. When it comes to conceptualization, sometimes it is more theory-driven, technical understandings of the client concern. But what I really believe is including a systemic lens is very understanding. For that, I can say that we need to have a very holistic and comprehensive model or approach which balances the causative and contributory factors of biological, psychological, social factors impacting mental health. Because as we know, the mental health concerns are mostly multifactorial, right? There are no single thing that we can point it out and say that this is causing this. So mental health clinician needs to be very sensitive of the context of power, privilege, intersectionality of clients coming to therapy. And mental health professionals needs to be aware that sometimes men, due to the social conditioning or the social context, may be reluctant to seek service, or maybe even reluctant to share their vulnerabilities. So when we engage with the clients of different gender identities, clinicians needs to have an understanding of the socio-political context of this particular gender in our current scenario, and aid the client to better support themselves in the therapy process. Because this is, especially men seeking therapy, is not culturally accepted for some reason, because they are supposed to be tough, self-reliant, independent, and it is more appropriate for men to show aggressive behavior in a given cultural context rather than crying for help or asking for help. So we need to have this sort of understanding when we try to understand our client concerns from a systemic lens. This is not only the way, but this understanding will help us to facilitate their change better.
Yeah, yeah. I think you said something about me thinking about how it's not just the system that'll stop them from reaching or accessing
Mhm.
mental health services, but there might also be ways in which it will show up once they're in therapy.
Yeah.
What can you share a little more about that? Do you think there are, you spoke a little bit about it, about certain emotions that men might feel more comfortable sharing, but what other ways
Mhm.
do you think it shows up in sessions?
Mhm. I think this is the most important question that we have to discuss because what we can understand that there is a silent crisis in men's mental health,
Hmm.
and some studies have even found more prevalence of certain mental health outcome in men than in women. For
Hmm.
example, surveys around the world have found that men are more reluctant to talk about their mental health concerns, and they are more likely to die by suicide than women.
Yeah.
And for example, although the common mental health disorders are mostly diagnosed in women, when we read the literature, we have to be very cautious of the social political system. For example, in US, one study shows that 6 million American men experience depression, but they go undiagnosed.
Hmm.
And this is partly because we have much documented evidences which show that men are less likely to acknowledge and report possible symptoms of mood disorder, such as depression, and they tend to judge their symptoms in a less severe way compared to a woman. This could be because we have understanding that men who adhere to traditional masculine norms such as self-reliance, being independent, self-control, etc., are less likely to disclose mental health concerns or seek help for assistance.
Yeah.
Okay. For example, we can consider this that depression, like in the given context, men may be showing depression or depressive symptoms more in the form of anger, aggression, irritability, or showcase their distress in a more culturally appropriate way,
Right.
because that is what men are supposed to do in a given cultural context.
Yeah.
And some studies even saying that even these mood related symptoms can be manifested physiologically rather than psychologically. So they
Hmm.
may be seeking physical health services.
Correct.
Uh, One very important thing is that suppose if a man is kind of relating them with the dominant masculinity roles and everything, they are less likely to seek help.
Hmm.
Okay. So, and also some researchers are saying that there is something called male depressive syndrome, because in our society, women, when faced with the psychological or psychosocial challenges, tend to act in, while men tend to act out. Acting out means engaging in high risk behavior,
Hmm.
engaging in substance use, engaging in drug use, engaging in poor impulse control, anger, or aggression, which is kind of consistent with the traditional masculine roles, right?
Right.
So, and we can say that although kind of we understand, like for example, depression is more common in women and less in men. Maybe that is not true. Suppose if you are taking the acting out behavior such as impulse control, drinking, the risk taking activity, studies have found that maybe men and women may have equal ratio or proportion of mental health condition. It is not very gendered, but
Right.
our understanding is very skewed because we count people who come to clinic, and we know people who don't seek help. But
Correct.
we also need to understand that there are several reasons for men to not seek help because it is culturally inconsistent with
Yeah.
what they are told to do. Yeah.
Right. Right. Yeah. I think that's really informative and something maybe a lot of us don't think about as much,
Yeah.
or a lot of people might not even
Yeah.
be aware that this is something that is happening and
Yeah.
it's real. So thank you a lot for
Yeah.
putting it together so concisely.
Yeah, sure.
And I guess the last question I have for you is, as a therapist, as a male therapist, what would you say your hope or your vision is when it comes to men's mental health in India?
Okay. Okay, mental health itself in India, although it is gaining the momentum, there is increasing awareness program or discussion about mental health in general. The current momentum is kind of very disproportionate to what we actually need. Suppose if you are taking the treatment gap, roughly it is 90%, which means only 10% of people who need treatment is getting treatment, right? And also, India is a very patriarchal society, so men seeking mental health services can be a huge challenge for men because there is so much stigma associated with men's mental health. Because seeking help is seen as being vulnerable, being fragile, being emotionally down, which is not consistent with the dominant narrative that we discussed so far. So we need to really have this sort of conversations about men's mental health from a systemic perspective rather than understanding it from a reductionist biological perspective. And also we need to talk about mental health of elderly men, because they are also out of this scene. And as clinicians, sometimes we also need to actively engage in deconstructing the notion about masculinity. Because as I mentioned, men who strongly associate with beliefs about masculinity is half as less likely to approach a mental health practitioner when compared with the men with a moderate level of masculinity. So we really need to reconstruct the notion surrounding masculinity, and we maybe need to start discussions about masculinity and mental health. And there is and this is very evident that men are more likely to die by suicide more than female counterparts. And this disparity, in part, is also the greater reluctance among male to seek mental health treatment due to internalized expectations around masculine behavior. So one vision we all can have as mental health professionals is encouraging and acknowledging mental health of men from the lens of diversity and inclusivity. But at the same time, parallelly, we need to work on stigma reduction and deconstructing masculinity that is preventing men from entering into therapeutic spaces. Even this is not only preventing them from entering into therapeutic spaces, like how much they continue therapy, how much outcome they may experience after therapy. Even sometimes, can I share to my friend that I'm going for therapy? Maybe if in a social cultural context, a woman sharing this same is considered as okay behavior. Maybe men sharing this same maybe is not appreciated among their peers. So these are the things that we can envision for the future. I don't know when will it happen, but things are changing. And with more effort, we may have more momentum in this activity.
Absolutely.
Yeah.
I think it's so important what you said, that as mental health professionals, it's our job is also to do that for our clients, to do the deconstruction, to be the creators of change, like you said, because it's not just with that one person that we're in the session with, it's also the larger systems that they come from. And I guess that makes it important for us to also bring those systems into the therapeutic space, and work together to acknowledge and deconstruct them. Yeah, that's great. So thank you so much for
thank you so much for having me here also.
Yeah, I had a lot of fun, and I hope people watching this also take away something from this conversation.
Yeah.
Yeah, thank you.
Okay, thank you.